Hi, my name is Mrs. Sickerick. I'm going to be your counselor today. What's your name?
I'm Lauren.
Hi, nice to meet you, Lauren.
Nice to meet you.
Okay, today we're going to be filming for educational purposes. Anything that you say in this room remains confidential unless you are of harm to yourself or others. Okay?
Okay.
Okay. So, Lauren, what brings you in today?
Well, I'm having a little problem with managing my weight
Okay.
and maintaining my weight, and I'm just not taking the healthiest route when it comes to doing that, and need to work on that, I guess.
Okay. How long has this been going on for?
For about 2 years now.
Okay. So from what you've been saying, you've been, going through some weight problems.
Yes.
Am I correct?
Mm-hmm.
Okay. All right. So the first thing is, how many? I just want to, get a clear understanding, just of, your symptoms and everything, and just some more background information about like what you actually do each day. So how many times a day do you eat?
Anywhere from 2 to 4 times a day, but every time I eat, I feel the need to purge afterwards.
Okay. So when you say you feel the need to purge, do you actually purge?
Yes.
Okay. Again, just want to, correct me if I'm wrong. And how long has this been going on for? You said
about 2 years
Yes.
now.
Okay.
I joined a gymnastics team. Well, I've always done gymnastics. And when I started high school, I joined the varsity team, and I've been going to all the competitions and been going to all of the practices, and have really been trying to make an effort to do my best and to be my best. Especially since I'm a perfectionist, like being the best is something that's very important to me.
Mm-hmm.
And I'm noticing like all of these girls that are doing gymnastics with me and in the competitions and competing, a lot of them look a certain way.
Okay.
But there are those few that are clearly overweight, and who wants to be overweight in a leotard and doing cartwheels and back handsprings, and you just see everything.
I understand.
I really don't want to be one of those people, and I want to make sure that I stay a certain way.
Okay, so let me just stop you right there. So what I'm hearing from you is that, you are a gymnast, and, you strive to be the best you can be every day. And now, you're looking at, other females in their class, and you're comparing your body to theirs. Am I correct?
Yeah, definitely. Yeah.
Okay. And when you were speaking before, you mentioned the term overweight, right?
Mm-hmm.
What do you consider overweight? What's overweight to you?
It really depends, I guess. I don't know, I just have this idea of, like, in my head of the perfect body type.
Okay.
And sometimes I feel like if I don't do these things, I'm going to not meet that image in my head
Okay.
of what needs to be.
Okay. So you mentioned the perfect body type. In your mind, what is that perfect image?
Just very thin and with hardly any body fat at all on them, especially when you're in like tight clothing that shows everything. Like you want to be lean and have the flat stomach and the thin arms and the muscular legs. And
Right.
you don't want to be fat
Okay.
and in a leotard.
Right. I understand. Okay. All right. Okay. So okay. So just going, I guess, back to, you know, um, when you were saying, that you're in the class, and looking at, other girls and just comparing yourself. It seems that, you feel like you kind of want to look like them because they have that quote unquote muscle tone that you desire. Okay.
Yeah. Well, I mean, I definitely think certain parts of my body are fatter than what some of these other girls have.
Okay. Has anything happened like recently to bring these on?
No, I mean, I think just with the whole like competitive aspect of the sport and the fact that I want to do well, it just, the stress of it all kind of brought it on.
Okay. Can you tell me more about that?
I mean, it is really stressful having to be perfect all the time. By having to constantly meet this certain standard and be the best at what I do and do good in school and do good in gymnastics and keep up with my teammates, and it's a lot of pressure.
Right, I understand. Okay. So it kind of seems to me right now that, your self-esteem is kind of is down, a little bit because you, are seeing, you're seeing what's going on in the in the gym, in the facility that you're, practicing at, right? Okay. Right. Is there anything else you would like to expand upon? I mean, I could give you a little bit to just gather your thoughts.
Okay. I mean, I don't know. I just think, like, I just want to do this. Like, I want to be this image in my head. Therefore, I want to, obviously I have to eat, but I don't want to eat.
Right.
And after I eat, I want to purge.
Okay.
Because I want to keep that certain,
Right.
like, body type, I guess.
Okay. So you said you want to purge, right? What what's going through your mind? What kind of sensations are you feeling after you purge?
Part of me is really happy because I know I'm doing what I want by maintaining a certain look, but at the same time, I guess it kind of bothers me that I'm going to this extent.
Right. Okay. I understand. I understand. So what, what kind of symptoms are you experiencing on a day-to-day basis since you, from what you tell me, since you're purging? What kind of symptoms are you experiencing psychologically, physiologically?
Well, I mean, I get tired pretty easily because of the lack of food in my body. I just feel like weak sometimes, and I'll get dizzy, and especially when I'm doing gymnastics.
Okay.
So, that kind of.
All right.
Is a side effect, I guess.
Right. Okay. All right. So, based off of all that, I just want to know, what are your goals just coming out of therapy? What would you like to see change?
To, I guess, sort of come up with a healthier way, so that a healthier way that I could deal with my weight.
Okay.
And being overweight.
Okay. All right. So, from what I'm getting at, in my estimation, on one hand, you say you want to get better, but what I'm experiencing, through your behaviors right now, is that you have the need to purge in order to feel good, right?
Yeah.
Okay. Is there anything that you can do, to combat that?
I mean, I don't know if I so much want to purge, but it's just something that I feel I need to do in order to maintain a certain way.
Okay. All right. So, based off of everything, you're saying, you still want to be healthy, but yet at the same time, you want to purge. And that's kind of like,
I just want to meet this, sorry, not to cut you off, but I just want to meet this specific criteria, like this image.
Okay, I understand. All right.
And be healthy.
Okay. So that's kind of like the pattern that I'm kind of noticing. I could tell, you're a perfectionist, and you want to meet this ideal image, and yet there's still a little bit from what you're saying, an unhealthy route that you're experiencing. Okay, well, right now I would like to, have you ever heard of cognitive behavioral therapy?
No.
No. Okay. So, cognitive behavioral therapy is a therapy that is used just to change, your behaviors.
Okay.
So it's your thoughts and your feelings, and it's influencing your behaviors. So the goal of it is just to change that negative behavior, or that irrational thought, so to speak.
Mm-hmm.
Okay?
Okay.
All right. So let's try the first technique. Okay? All right. This one is called cognitive restructuring. Okay? So what's going to happen here is that we're going to change your irrational automatic thoughts, the thoughts that just come out. Okay? And we're going to filter them and, try to make them a little bit more positive.
Mm-hmm.
Okay? So, as we were speaking, I wrote down some of the phrases that kept coming up throughout the session. Okay? So what I would like you to do is just take this paper, and we're going to read one by one. Okay? So if you would read the first statement.
I am not good enough.
Okay. So that came up, a couple times in our session. What is a better way of thinking about this?
Nobody ever said that I'm not good enough. I do have, I guess I have a good family, and I have a lot of friends, and they all like me.
Okay.
So, and I always do well when I perform in gymnastics. So.
Okay. All right. So you're not, from what you're telling me, you're not 100% certain that you're not good enough, based off of what you just said.
Yeah. Yeah, I guess so.
Okay. If you go along with the second one that was written down.
I am fat.
Okay. When thinking about this, do you have any evidence to support this?
Well, no. I don't know. No one's ever, told me I'm fat. But, yeah. No one's ever told me that.
Okay. All right. And then the last one that kept coming up. If you read that.
I want to binge and purge.
Okay. Is there something that you can say to yourself just to make this a positive, to kind of flip it?
Maybe I don't necessarily want to binge and purge. And I can come up with different ways to stay healthy without purging.
Okay. Okay. So, that's a start right there. You can think of, some other ways to, stay healthy. Okay. And now, I'm going to give you a copy of this. As you were speaking, I was writing down, what you were saying, and I want you to keep a copy of these positive statements, and I would like you to keep it by your bed, or, if you're feeling down, you could just go along and read them and say them back to yourself, because it's all things that you've expressed to me in a different light. Okay. And then the goal here was just to, just kind of to retrain your whole thought process.
Yeah.
And that's the whole meaning behind that. Okay?
Okay.
Did you think that was beneficial?
Yeah, I definitely think it might help me if I try and focus on more positive things to say about myself other than negative.
Okay. All right. So now that we did that, there is just one more technique that I would like to try. It's called exposure and response prevention. So what this does is that I'm going to expose you to the behavior, which is, your eating. And then we're going to have to, so to speak, just make an effort not to give in to that negative behavior. Okay?
Okay.
Is this something that you would like to try?
I mean, if you think it would help.
Okay.
I don't know. I'm feeling a little anxious, a little nervous.
Okay. Being anxious and nervous is, a part of is a part of therapy when you, first enter it, because you don't know what to expect, and as time goes on, you kind of get more comfortable with it.
Yeah.
Okay. So we could try it, and if you feel uncomfortable in any way, we can stop.
Okay.
Okay. Okay. So the first thing is, I have a bowl of food over here. What I would like you to do is just take it.
Okay.
Okay. And then I would like you to, when you're ready, start eating, gradually at your own pace.
Okay.
Okay. Can you tell me what you were experiencing during that time?
Just a little concerned about how many calories are in this.
Okay, I understand.
And I don't know, it's just giving me a little anxiety.
Okay. High anxiety, low anxiety?
I mean, I was really, really anxious when you first brought it up, but once I kind of ate the first bite and then the second bite, it lessened a little bit.
Okay. All right, now let's just try one more time, and if you can, just finish whatever's on the plate.
Okay.
Okay. Now sit there for a little bit, and kind of just get in touch with yourself and let me know kind of what you're experiencing now, since you've been sitting there for a little bit.
I mean, definitely a little bit better. As I said, like, when you first asked me to do that, I was pretty anxious, but it wasn't as bad as I guess I make it out to be.
Okay. Well, you did, okay, I understand. It took a lot of strength for you to come here today, and kind of just go over these techniques, but I would just like to wrap up and just sum up just what we spoke about, before, from everything that you said to what I said. First of all, what we stated was that, you are a perfectionist, and, you're a gymnast, and you're very competitive. You come from a supportive family, but yet you have a desire to, fit that ideal gymnastic body image. Right? And that's kind of something, that we're here to kind of just, focus on. Goals, when we speak about goals, just as we did in the technique, the goal, based off of that technique, what do you think a good goal would be?
Just to work on changing how negatively I view myself, I guess, and try and come up with healthier alternatives than eating my feelings and then purging my feelings.
Okay.
And my insecurities.
Okay, well, we can definitely work on that. Okay. So for homework, what I'd like you to do is to do a food diary. Okay. In that food diary, I want you to have 3 meals a day: breakfast, lunch, and dinner, with a couple of snacks in between. Is that something you might feel comfortable with?
Okay.
Okay. And then, just to kind of write down, the times that you ate and what you experienced after each meal. If you purged, just write down, that you purged and, what you get from it, what kind of feelings are associated with it.
Okay.
Okay. Do you think that's something that you can do?
Yeah.
Would you like to make any changes to it?
No, I could do that.
Okay. All right. So we'll meet again next week, and we'll discuss your progress. Okay?
Okay.
Okay. It was nice meeting you.
It was nice meeting you too. Thank you.
Yeah.